Good morning, I'm Amy Lynn. Many clinical trials have come to a halt during this pandemic, but the good news is many trials are changing their philosophy to make them more accessible to patients. Here with more details on what that can mean for you are Dr. David Carbone and lung cancer patient Gina Hollenbeck. Thank you both so much for coming on this morning. Doctor, I want to start with you. Why are clinical trials so important, especially for patients that are battling lung cancer?
Well, clinical trials is how we test new treatments and get them to patients. Over the last few decades, we've really done a lot of basic research that's developed mechanisms of why cancers grow and why cancers evade the immune system. And we've come up with ideas about how to treat it. But clinical trials are how we actually get those treatments into patients, figure out how effective they are and how safe they are. And so they're extremely important.
Gina, can you please share with us your lung cancer story?
Sure. I was diagnosed in 2015 with stage 4 lung cancer. It had already spread to my brain, and I was working as a nurse then, and I was completely shocked that someone with absolutely no risk factors could get lung cancer. My only symptom was a cough. And luckily, I had a doctor who knew to do comprehensive biomarker testing. So he looked at my cancer tumor and he looked at the DNA of it to see what was driving it. And we found out that I was eligible for a targeted therapy.
That is so amazing. Doctor, can you talk to us about how COVID-19 has impacted clinical trials?
Well, COVID has impacted every aspect of our lives, but especially in the medical profession, all the way from the basic researchers doing the studies in the lab to the clinicians taking care of patients in the hospital.
Gina, would you feel safe enrolling in a clinical trial during COVID?
I think that whenever you enroll in a clinical trial, it's really important to ask questions. So you have to make sure you understand what is being asked of you. And so, once you know that, you can take it back to your medical professionals and your medical team and kind of weigh the pros and cons. And once you know those, then I think it's okay to say, yes, I want to participate in a clinical trial.
Gina, what would you say to patients right now that are concerned about joining a clinical trial because of the current pandemic?
The clinical trials are the reason that we have new research that can create new treatments. So I would definitely say to anyone, ask questions and then ask even more questions. But know that the researchers want to make sure that patients are safe. And so it's important to, ask those questions.
If you log on to our website, you can find out more details at fox4morningblend.com.
Good Friday morning, everybody.